All right, Kylie, thank you. Well, an Indianapolis-based revenue cycle management company is playing a role in helping to get the COVID-19 vaccine to Hoosiers. Zotec Partners, partnering with the Indiana Department of Health to track inventory levels and reallocation of the vaccine. The company also using its technology, a platform to schedule and communicate with those receiving the vaccine. Zotec Partners founder and Chief Executive Officer Scott Law joins me now with details. Scott, welcome to the program.
Well, thank you very much for having me, Gary.
Yeah, I think Zotec is a great example. I know Governor Holcomb has talked a lot about Indiana companies stepping up and helping during the course of this pandemic. To tee things up, though, Scott, give us a thumbnail description of your company, Zotec Partners. And I know you launched it in 1998 and have had some real success since then.
Well, we started in '98. We're a Hoosier born and bred company. So from the ground up, we started here and have grown the business to where today we do about 120 million medical encounters across the country. We operate in all 50 states, but our headquarters is here and most of our personnel are here. And we're working towards basically making the process of getting medical encounters turned into cash for our physician clients.
Scott, talk about your initial connection with the Indiana State Department of Health in the spring, shortly after the pandemic hit. Your company was impacted by the pandemic in terms of from the business side. Why get engaged and get involved with the state in the fight against the pandemic?
Well, we were obviously with the elective procedures, and once the pandemic started hitting the physician communities that we serve, we were obviously looking for ways to help in any way we possibly could to recover as quickly as possible. So we engaged with the state on using our technology. The problem in healthcare is a lot of different technology platforms exist, but no one source for all of the data that could be achieved or accumulated in order to help this process. So we started with a prevalence study on the testing side of the equation to look at where was the virus, where was it more prevalent in certain counties and certain geographic areas. We statistically developed some capabilities to basically test and market to those people who were randomly selected in order to test and get a statistically valid sample size out of the state of Indiana. And then that was helpful in determining where to put the resources for any potential additional testing, quarantining, or tracing methodologies that were put in place.
Well, and you've really bolstered or enhanced that relationship with the State Department of Health. Now dealing more specifically with the vaccine. Talk about your role there and, in your view, how it's impacting vaccine access distribution.
Well, it's very important that, instead of waiting in line in cars and having it be a first come, first served basis, the state was very, very thoughtful relative to how to notify people that they were eligible for the vaccine, how to make sure that they were scheduled for an appointment, the physical logistics management of the two different vaccines, how to keep the inventory in stock relative to each individual vaccine, whether it would be the first dose or the second dose. It's a complex logistic nightmare, as well as it's also important to make sure that it's easy for the patient to get a scheduled appointment, but more importantly, to be on time when they're there so that they're not standing in line, exposing themselves to the virus or others to the virus as well. And as the logistics of actually thawing the vaccine in time to make sure that you can keep the line moving and keep people very, very quickly through that process.
What's your take, Scott, on how Indiana is positioned when it comes to the vaccine and distribution and that whole process? What, in your view, is really the biggest challenges facing the state right now when it comes to the vaccine?
Well, the state has actually taken a very comprehensive, very thought-out approach. Dr. Box and Dr. Weaver are on top of their game compared to some of the states that we've talked to. Obviously, during this process, people get word out that we're helping with the state of Indiana, and they've asked us to help and guide them through other aspects. The biggest problem right now, I think, that the state faces is getting vaccine supplied from the federal government, or what the process is going to be about that. We've proven time and time again that we can handle the volume. The 200 plus locations are set up and ready to go. We can put the shots in the arms for Hoosiers, but we need to get the vaccine. I think that's the biggest challenge they're facing now.
Scott Law, Zotec Partners. Scott, really appreciate you taking the time to join us, and thanks for the work with respect to the pandemic, the vaccine. We'll hopefully talk to you soon in person once we get on the other side of this.
Yes, sir. I look forward to it. Thank you very much, Gary.
All right, Scott.